Hi, welcome to Myrtle's Detox and Wellness Spa. This is our second lesson, diabetes. And the topic for today is risk factors diabetes. So, why does one become diabetic? What are the risk factors that causes diabetes? So, some of the risk factors we cannot change, and there are others that can be changed. So first, we're going to go through those that we can change. For example, if you're overweight, that can be changed. You can exercise, you can reduce your portions, you can stop eating at a certain time, you can get enough rest, you can stop stressing. All these things has a role in being or causing one to be overweight. Then the second thing that can be changed is a sedentary lifestyle. So you can get up, you can go and exercise. Okay. If you're at a job that you sit a lot for the day, get up at intervals during the day and go and take a walk and then come back to your desk. That's number two. Number three, if your cholesterol is high, that puts you at risk for diabetes as well. Okay, so you need to work on that with your doctor, adjusting your nutrition, work with a nutritionist in reference to what you can eat to adjust your cholesterol. And then we have syndrome X. Now, syndrome X has to do with a cluster of things. By the way, the information I'm giving you was collected from a research at University of Illinois in Chicago, okay, back in the early 2000s. So the information is coming from them. Now, syndrome X has to do with elevated triglycerides, low HDL, that's a high density lipoprotein. Also, your blood pressure is high, your fasting blood sugar is high, and you have an excessive amount of weight around your waistline. For females, your waist should be less than 34. Doesn't matter how tall you are, your waist should be less than 34. And for males, it should be less than 40. So those can be adjusted, okay? Exercising, doing waist twists, bending from side to side, that helps to lessen your waistline. The more fat padding you have around your midsection, the more likely you will become diabetic. Okay, so we can reduce that. That's a risk factor that we need to adjust. Then if you're pre-diabetic, you're not diabetic yet, the doctor says, oh, your sugar is a little high. Well, that's time to do something to reverse that pre-diabetic status. Because if you leave it there, it's going to put you over into diabetic range if you do nothing about it. That's number 5. Number 6 is called polycystic ovarian syndrome. Polycystic ovarian syndrome. This causes missed periods or long pauses between periods, long span, long time frame between seeing one's menses to when they see it again. It causes infertility in some people. It's actually an absence of ovulation. Now, someone's hormones may be off, or they may have an increase of male hormones. So now you're female, but you have a lot of facial hair. You may have acne. You also may have cysts on your ovaries. Okay, so those cluster of things causes what's called polycystic ovarian syndrome, and that puts you at risk for diabetes. Now, this can be changed. You need to work along with your doctor, getting your hormones adjusted, and so that risk factor can be reversed. Okay, so the 6 things that I mentioned that you can do something about are being overweight, having a sedentary lifestyle, your cholesterol is high, then you have syndrome X, that is a cluster of your triglycerides being high and your HDL being low, your blood pressure is high, your fasting blood sugar is high, and you have too much waist circumference. Your waist is too big. For females, it's over 34, and for males, it's above 40. So females, your waist should be less than 34, and for the males, less than 40. Okay, so that's a risk factor for diabetes. Then if you're pre-diabetic, don't stay in that range and say, oh, well, I am not diabetic yet. Reverse it. Adjust your sugar intake. Do some exercises. Watch what you eat. Get enough sleep. Drink enough water. All these things would help with getting your prediabetes back in check. Then number 6 is the polycystic ovarian syndrome, which causes missed periods. It has to do with infertility, long spans between periods, absence of ovulation. Your insulin in your blood is high, and you have masculine hormones, and you may have facial hair and acne, and even cysts on your ovaries. So all of those can be reversed. Now we're going to go to the non-modifiable risk factors. They are what they are. You cannot change them. Okay, so your age. You may want to hide your age and not tell your correct age, but your body knows your age. So the older you get, the more likely you are to become diabetic. Then you have genetics. Your grandmother, your mother, your father, your auntie, your cousin, your brother, your sister, all diabetics. Those are not modifiable. It is what it is. Okay? So that's the second risk factor that you cannot change. Then for females who were pregnant and during pregnancy they became diabetic, it's called gestational diabetes. This puts you at risk for becoming diabetic later on. That you cannot change. You already had gestational diabetes, so it's there. It's part of your history. And then your ethnicity, number 4. Okay, so those are the 4 things. You cannot change your race. You cannot change your ethnicity. You may want to check a different box, but you are who you are. Your age, your genetics, your ethnicity, and if you were diabetic during pregnancy, if you had gestational diabetes, those are the 4 things, the 4 risk factors that are not changeable. So I hope you guys know what you can change and know what you can't change. There's only 4 that you can't change, but the other 6 you can definitely do something about. Now, I'm hoping to bring to you more lessons on diabetes. There should be at least 8 of them in this series, and I'm hoping to post at least once a week, every Thursday, and look out for the others as they come along. So just check for the one that was posted before, lesson 1, and this is now lesson 2, risk factors for diabetes. I hope you were informed. I hope this was beneficial. Do like, share, subscribe, and put on that notification bell so the next time I upload a video, you'll be sure to get it and not miss it. Now, stay blessed and have a wonderful day. Change the risk factors that you can change and lead a healthy life. Bye. See you next time.